Senior Consultant Interventional Pulmonologist at Aster Hospital, Bangalore. To discuss one of the most pertinent topic, we are here to discuss some of the frequently asked questions, and because of my colleague was supposed to moderate this particular session, because of emergency is not able to make up. I have one more equally competent colleague of mine.
Person who is staying in respiratory medicine, I would like to ask few questions.
Yeah, now before we start with the primary topic per se, the topic for what we have chosen is pneumonia. Now each and every year we come with a World Pneumonia Day, which is supposed to be on 12th of November. Starting from 2009, every yearly we recognize this November 12th as a World Pneumonia Day. The theme for this World Pneumonia Day is championing the fight to stop pneumonia. Why have we chosen this topic? I think to discuss all this thing in the micro dissections, I have my colleague who is going to run through some of the most frequently asked questions to make it more lively.
Okay, yes. Sir. What is pneumonia and what is the burden of pneumonia?
No, before going into pneumonia, actually we need to understand what is the normal lung architecture. We have a main windpipe called trachea, divides more than 23 times before ending into alveoli or sac-like structures. Normally these sac structures are lined by epithelia. Because of this infection predisposition, there might be too much of exuberant of secretions in the form of mucus or fluid content in the alveoli, which will hamper the normal oxygen diffusion across this alveoli into the blood vessels, presenting with us pneumonia. Pneumonia is nothing but inflammation in the windpipe, causing the sac to be filled up with the fluid or mucus secretions. Now, when it comes to why have we taken this topic, the amount of burden what it causes actually humongous. The incidence is roughly 20 to 25 cases per 1,000 population. Roughly it can go up to 450 million. The staggering numbers, 450 million cases. In that, 5 million deaths. I think that's literally staggering numbers, which makes us to think that this has to be given a due diligence. In India, constitutes more than 2/3 of global burden to pneumonia. And at the same time, in the 23%, more than 50 to 20% of mortality is accompanied by India.
Sir, what are the common symptoms that may indicate pneumonia?
Somebody who presents with fever, cough with expectoration, and breathlessness are the classical symptoms what the patient do present with. Now, anything with lung parenchymal involvement invariably has cough with sputum production. Sputum initially it can be high color like green or yellowish, over a period of time it can transform into a more transparent color also. So this as a basic connects to define pneumonia. And on top of the symptoms, a predominantly lab investigation, X-ray, a patch on an X-ray gives us a acronym for your pneumonia.
Sir, are there different types of pneumonia? Do they require different treatment?
Yeah, Ashish, that's a good question actually. We should understand that what are different types of pneumonia. For a medical, from the site of contact, like we have a community acquired pneumonia and healthcare associated pneumonia. Community acquired pneumonia, somebody who is out of hospital setup, maybe clinic or something, in the community level, what are the most common organisms causing this pneumonia? As compared to hospital or healthcare acquired pneumonias, we have two divisions, hospital acquired and ventilator associated pneumonia, where more classically seen when somebody comes to hospitalization for more than two days or 48 hours, developing new patches on the X-ray qualifies to call a healthcare association. And somebody put on a mechanical ventilation after 48 hours, new patches on the X-ray called ventilator associated pneumonia. Now, it's two distinct things which has to be clearly understood. Community acquired pneumonia present with a milder form of infection as compared to healthcare, which will present with more of a multi-drug resistant bugs, difficult to treat and at the same time challenging in terms of predicting the outcomes. When it comes to community acquired pneumonia, most common streptococcus pneumonia. As compared to healthcare associated, we have a gram-negative bacilli with multi-drug resistance.
What are the typical treatments for pneumonia, and are antibiotics always necessary?
No, that's a wonderful question actually. For all the viewers, actually pneumonia nothing but clinical symptoms with the radiological features of patches in the lung on X-ray qualifies to call pneumonia. Now, if somebody comes with this fever, cough, breathlessness, and saturations being monitored, if it is less than 90, qualifies for hospitalization. And if it is more than 92 to 94, can be comfortably managed at home. We need to understand what are risk factors for this sort of pneumonia. Anybody who's extremes of age less than 2 years, more than 65 years of age, with comorbid conditions, with overcrowding or any poor hygiene and air environmental pollutions, all these things contribute as the risk factors for somebody to develop pneumonia. And at the same time, if you have different types, which makes it easier in terms of how to segregate these things so that this can be addressed in a comprehensive way.
Can pneumonia be managed at home, or is hospitalization always required?
Yes, that's a wonderful question. Now, when it comes to your management of a pneumonia, more than 60 to 70% can be managed at home with good hydration, if there is any fever, antipyretics, and a base and antibiotics. To get these things sorted out, we have severity scorings. When it comes to any patient who comes to fever, cough, breathing difficulty, to emergency, first and foremost, our colleagues in emergency does what is the oxygen saturation level using a pulse oximeter. At the same time, if the high suspicion of dyspnea and cough with expectation, do for an X-ray. Putting all clinical, radiological, investigation parameters, we come to the consensus based on the saturation level. If it is less than 90, definitely need hospitalization. Are there any scoring system which can guide us whether the patient can be treated in the home, ward, or ICU? We have 2-3 scorings which is through the test of time in doing this best job. We have curve 65 or pneumonia severity index, incorporating more than 12 parameters to take the judgment whether they get benefited by home care or not. Mildest of the mildest can be treated at home with plenty of hydration, good amount of oral antibiotics, and a personal care, as compared to somebody who is having a higher score, need a hospital admission either into ward or ICU.
Sir, how long does it take to recover from pneumonia, and what factors it influences for the recovery time?
That's a golden question actually. Basically, the recovery depends upon the age of the person, extremes of age already vulnerable, immunocompromised, like somebody who's having HIV, somebody has a poor controlled diabetes, somebody on malignancy on a chemotherapy medication. At the same time, off late we have seen more of a transplant things coming up in the picture, and with a lot of immunosuppression being used, which is always a vulnerable point to get out of this sort of infections. At the same time, we have a subset of somebody who is exposed to outside atmosphere with a lot of air pollution, and at the same time we have extremes of age also contributing for this sort of a high prevalence, which needs a better care to get the things sorted.
So what lifestyle modifications can I do during and after the pneumonia treatment?
So basically, when we have this pneumonia, depends on the recovery pattern. Extremes of age will always establish. Generally, usual norms. Clinical well-being is the one thing first and foremost. 24 to 48 hours within a 2 with a good amount of appropriate antibiotic, we see the clinically patient being better. At the same time, lab parameters like your CRP, ProCast, these are the markers which generally predicts what is the severity of the infection and how to prognosticate. Now, in this particular scenario, 4 to 5 days of good antibiotics, people of different age group responds appropriately, and if in spite of all these measures in terms of personal protection, in spite of antibiotics, if we are tracking the patients and patients are still not getting better, still dyspneic, still having fever persistent, this qualifies to have differential diagnosis. What is the reason for this delayed or failure of a treatments in this particular patient? It can be resistant to tuberculosis, resistant to any of the medication what we use, or extremes of age. At the same time, immunocompromised nature of the host can be a reason for this failure of this resolution.
So, are there any potential complications or long-term effects of pneumonia to be aware of?
Definitely. This is a thing where any pneumonia, we know that it is confined to lungs. Present with cough with expectoration is the predominant symptom. When there's too much of inflammation within the lung parenchyma, it can get into a mode of exuberant amount of inflammation which can involve pleura. Now there is a covering which is to the lung, is called visceral pleura, something which covers the chest wall called the parietal pleura. Parietal pleura is a very pain sensitive structure. Because of this inflammation, there is a pleurisy where if you take a deep breath, there is a pain or a catching, pricking pain, what's classically noted. Invariably pleural effusion, the fluid which builds up in this area because of inflammation or a cytokine storm is also known thing to happen. At the same time, over a period of time, the infection which is confined to lung can be disseminated into the bloodstream, causing bacteremia. Any bacteria emitting into the bloodstream, and the clinical potential of that sepsis or a septic shock, where your BP get compromised actually, needing a medication to support your blood pressures so that the vitality of a major organs like your heart, kidney, liver can be maintained. At the same time, they have predisposition to develop what is called acute respiratory failure, needing into a RDS, okay, nothing but acute respiratory distress syndrome, which has a bit of a more mortality to the tune of 30 to 40%. Other complication, pleural effusion, lung abscess can be part of it. At the same time, kidney failure, respiratory failure, heart failure, or lung abscess. These are the most common complications if the pneumonia not getting curtailed.
What can I do to support my immune system and lung health during recovery?
That's a wonderful question actually. Practice good hygiene, proper hand washing, avoiding a crowded space, wearing a mask when somebody has the symptoms, somebody has cold cough, wearing the symptoms. If somebody is having a smoking habit, quit smoking and adapt healthy habits. Regularly exercise at least half an hour to 45 minutes. Good quality sleep, 7 to 8 hours of uninterrupted sleep and adequate rest. Consume balanced diet, rich in fruits and vegetables, whole grains, proteins, which is the major building blocks, and it is a immunoglobulins generating proteins, nutrients, and drinks lots of fluid. And the foremost thing, vaccination. Vaccination with pneumococcal pneumonia vaccinations and influenzas, yearly influenza vaccine. These are the good practice which will try to prevent the pneumonia to occur.
So, can you explain the link between pneumonia and respiratory conditions like COVID, which was there last?
Wonderful. I think if you go with a historical aspect, 2020 is a nightmare for anybody who is there in this era, where the best of the best healthcare system were brought into knees with this COVID. COVID predominantly transmits through aerosol. Anybody acquires some sort of infection, through aerosol can transmit to other person. Invariably, the lining of the airways get affected, predisposing somebody to develop pneumonia. Mind you, pneumonia can be because of any bacterial causes, viral causes, fungal causes, parasitic causes. Of late with COVID-19 being the major stuff actually in the last 2-3 years, where we have seen a good amount of mortality, and basically the patient with pneumonia has a severe form. If you see the spectrum of 100 patients of COVID, 80% are self-limiting with a symptomatic treatment, they'll get better. About 10 to 15 people who develop pneumonia or hypoxic with saturation less than 94, also called as happy hypoxia, where they need a supplemental support of oxygen, good amount of hydration, and a good amount of antiviral medication comes up handy to curtail this. Unfortunately, there are 1 to 2% patients who do progress to further complications, needing any sort of a long-term oxygenation, or needing, if they are flawed into a flawed ERDs, getting into a mechanical ventilation, going on to ECMO, and less than 1% in our setup got into a lung transplant indication in a COVID pneumonia.
So, is it possible to prevent recurrent pneumonia, and what preventive measures should I take?
See, that's the thing actually, where good balanced diet, mask, cough etiquette, when somebody has cold cough, sneezing, cough etiquette, these are the good practices what we need to follow. Balanced diet, also with retreat, and vaccines. Pneumococcal vaccine for all extremes of age less than 2 years, more than 65 years. At the same time, influenza vaccine, which is given around the year actually, for somebody with a structural lung disease, congestive cardiac failure, all this subset of patients, and immunocompromised patient, always a vaccination, annual vaccination is always a good preventive strategy. And if somebody is a smoker, smoking cessation goes without saying that the loaded words, smoking can be one of the good modality to avoid somebody to develop any sort of a pneumonia. Hand washings. Hand washings is one of the crucial steps to cut this barrier at the earliest.
It's too much. The questions are very informative, and answers too. Both were very much informative.
Thanks, Ashish. And this is the one short attempt what we have made to enumerate the general public what is pneumonia, starting from the mildest form. The take-home message is not to scare you people. Be aware of the pneumonia, word pneumonia affecting the lungs, age predisposition. Younger has a good outcomes as compared to the elderly population. So safeguarding prevention precautions is a need of the hour. Wearing a mask when you're getting into crowded spaces. When somebody has cold and cough, try to maintain some distance and good hygiene, and at the same time hand washings and a good balanced diet and a vaccination, annual vaccination. These are the key things which has to be kept in mind to get you away from all this menace of pneumonia complications. Thank you.
Thank you.